Pregnancy. It's common, it's natural, and yet it can turn complex in a heartbeat. So what should a straightforward pregnancy look like? When should a GP relax and when should alarm bells ring? Today on Aussie Med Ed, we're cutting through the noise on the management of pregnancy from their very first booking right through to delivery and postpartum care. Joining me today is obstetrician Dr Allison Munt.
And the first visit with the GP is important for a number of reasons, and they usually will rock up with an idea about their gestation based on their last menstrual period. So it's good for the GP to determine that, and to do that they should really be looking at the comprehensive health history of the patient and also examination just to see if it's a low-risk pregnancy or a high-risk pregnancy, what the patient's preferences are for ongoing pregnancy care in terms of models of care, calculating the due date, which is very important, and obviously examining the patient, which at that stage is just a general examination for general well-being, and then routine health testing as well, just screening for some initial blood tests that are really helpful to have when I see a patient perhaps for their first visit at 10 weeks. So with the history, like I said, the first thing that you're probably wanting to determine is how far along the patient is. In terms of clinical examination as well, one of the most important things is determining BMI, and that's a really important risk factor to help determine what best model of care for the patient is. And then blood pressure as well. So booking blood pressure is key in pregnancy, just to determine how that tracks from there. And even something as simple as white coat hypertension at such an early gestation is really important to determine risk as well. A general examination of the cardiovascular system is important, and then a breast examination probably at that point is always something that you should consider at that early stage. When you go on to consider some investigations, routine blood tests that we would expect at a first visit would be pretty simple, things like a full blood count to look at hemoglobin and platelets, and then some viral serologies. And the routine viral serologies that we do include rubella, syphilis, hepatitis B, C, HIV as well. And depending on risk, and this is something that doesn't necessarily need to be done at this stage, we may screen for other infections like CMV as well, which can be important as well.